morning. This is a program by One Good Step and Dr. A.V. Badiga Memorial Hospital in this channel, Mind Your Mind. Basically, our aim is to talk about common health issues, particularly mental health issues, which bother us. So today, I'll be talking on balance in marriage. In fact, this is one thing as a doctor, as a psychiatrist, what I have found is many times when there is no proper balance in marriage, one of the partners in the marriage suffers. He or she may develop a psychological issue, or he may not do well in his profession. He or she may end up visiting psychiatrists. And another important issue is, especially when a child is brought to me, I always look at that child as an effect of this particular issue called as marital discord, or sometimes it is the unkind taskmaster in the school or bullying by children. But most commonly it is this marital discord in parents which will cause problems to the child. So as a psychiatrist, what I am interested in is these four areas in marital life which are very important. The first one is affection. Are you affectionate to your spouse? Do you feel like showing affection to your spouse? Do you express your affection to the spouse? These are very important. In fact, there are some personality disorders who cannot express affection. Say, there is what is called as a schizoid personality. There is what is called as histrionic personality. He or she he expresses the affection. But the problem is there is actually nothing inside. It's just a hollow affection. So affection involves both verbal and non-verbal behavior as well as the intent. And many a times it could be events of the past which spoil the affection. Maybe some extramarital affair in one of the spouses, or maybe some unkind utterances, the way the spouse has treated your relatives. All these can affect affection. But still, if there is no affection in marriage, this is what we call as emotional divorce. In fact, one of my colleagues, Dr. Virupaksha, who has written a book on communication, he talks about this particular word called as emotional divorces. So there are people who live under one roof without any affection. So this becomes a very important aspect. So after affection is what is sexuality. So sexuality, again, there is no particular, dictum, but sex involves both verbal and non-verbal behavior, and affection is a very important part of sex. So many times, because I am not going to tell you some guidelines or how many times a couple should go into sexual intercourse, that is not important. Many a times, husband is living elsewhere, wife is living elsewhere, so many issues will be there. But still, what is important is a sexual dissatisfaction in either of the spouse can lead to a lot of problems. And many times we shy away from discussing about sexuality. Educated, uneducated, doctors, non-doctors, each of us, we feel that sexuality is not important. But as a doctor, I have realized a lot of people who come to a psychiatrist, the nidus of their problem could be an unhappy sexual life. So this unhappy sexual life in many people can lead to psychological distress. And many times we don't know what is the cause. Sometimes it could be the orientation, the sexual orientation. You must have heard about this LGBT. In fact, this is a very important concept. What happens is people do not discuss their orientation. People are afraid to discuss their orientation. And many times they do not refuse marriage despite having a homosexual orientation, and they come into marriage, then they have a lot of problems with sex. then they may have real sexual dysfunction. And what you should realize is the biggest sex organ is the brain. Many times psychogenic sexual dysfunction is very common. And many times it is these chronic diseases like diabetes, chronic mental illnesses, all these can contribute to sexual dysfunction. Many times medications they are taking also can contribute to sexual dysfunction. So sexuality is one area where the husband and wife, they should sit and discuss. If necessary, if they want to solve their problems, they should visit a psychiatrist. Then the next important issue is about parenting. Because what happens is, parenting is not only responsibility of the female sex. This is what, at least in our country, majority of the times I feel all the males feel that it is a responsibility of the female sex. It's wrong. When you bring up your children, the role of father and mother should be complementary to each other. And many a times we need to spend more time, we need to spend quality time with these children, we need to spend time together, we need to understand that we should not compare the child with our own child or somebody else, we should not criticize the child, we should express our affection to the child, we should find out the positives in the child and always encourage the child. And this should be done together. And here, if you have marital discord, please understand the child can manipulate. I have seen children of divorcees. What happens is they will be, as per law, going to both the parents. And many times what they do is they misuse the differences among parents. They misuse it, they manipulate it. So this is something which parents should realize. Especially if you are living together, what you should understand is your expressions, you are telling them what you want to do, what you want them to do. There should not be any ambivalence and it should not differ from each other. Even if you differ from each other, sort it out and never fight in front of your children. I would say never fight at all, but no marriage can be really existent without fights. It would be utopian to think that marriage, the married couple should not fight, but at least see that you don't fight in front of your children, you don't use bad words, you don't hit each other. Children bred by violence will always be violent. Please understand this. The last issue is financial transparency. See, in our country what happens is, if one of the spouses is working, the other is often neglected in decision making when it comes to finance. This is wrong. Both the couples should take part in this issue of making financial decisions. They should have frank discussions. They should together plan. There should be transparency. This is often neglected. Please understand that financial planning, especially with regard to your kids' education, maybe making a health insurance for you, your parents, your extended family, and many times issues on discussion like what you want to buy, all these become very important, and it is very necessary for you to be transparent on these matters. Please understand this. So basically what I want to tell you is, a happy, balanced marital life depends on understanding between each other, a good communication. In fact, communication is a very important phenomena, very important thing in a happy marriage. And I request you to give more time to each other, sit with each other, sit and discuss and arrive at a decision. And also, as far as possible, when there are differences in the family, in between you, do not involve the extended members, extended family. What happens is, many times problems between themselves can be projected on this particular difference of opinion, and this leads to a lot of issues. And please understand that a balanced family life, a balanced married life is the foundation stone for your children to come up in life, to do well in life, and it also gives you peace of mind. You look at any profession, if the person participating in a particular profession, if he has a very bad domestic life, he will have a lot of problems in the profession. So I would say a balanced family. Family is actually the smallest unit of society. If families are happy, children will be happy, the society will be happy. So basically, I end with this message, and again I am telling you, don't shy away from consulting a psychiatrist if there are problems, or a clinical psychologist, or a psychiatric social worker. Again, I repeat, the theme we started off with in our first video, what is very important is a good awareness, then acceptance of your problems, then analysis of why you are having problems and taking action. So know what is balanced family life from this video. Basically, this video is never a substitute for psychiatric consultation or visiting a clinical psychologist or a psychosocial consultant. This is only giving you information. So please do participate in these programs. Please encourage us, subscribe to our channel, press the bell button, and I also request you to participate by telling us what topics you want. And I thank you for a patient listening. Jai Hind.